This is the VOA Special English Health Report. South Africa plans to test 15 million people for HIV by June of next year. That is almost 1/3 of its population. South Africa has the most people living with HIV of any nation. The number of infected men, women, and children is estimated at more than 5.5 million, or 11% of the population. President Jacob Zuma launched the testing campaign on April 25th in Johannesburg. He announced the results of his latest blood test for HIV. He said the results in April, like the 3 earlier ones, were negative for the HIV virus. He said he was sharing the results to support openness and understanding. The country's former president, Thabo Mbeki, was known for the unaggressive way his government dealt with AIDS. He questioned whether HIV even caused the disease. The new testing and counseling campaign started at a single location in each of South Africa's 9 provinces in April. The program will be expanded every 2 months until 52 health centers are offering the service. The government says it will also expand treatment and support services. Francois Venter is a senior director in the Reproductive Health and HIV Research Unit at the University of Witwatersrand. He says the testing campaign may put additional stress on the health system, but that will show where the weaknesses are. He says knowing which areas of the system are going to cause future problems will make the effort worthwhile, even if the goal of 15 million is not reached. The South Africa National AIDS Council is heading the campaign. The council includes government representatives, medical experts, and health activists. The theme of the campaign is "I am responsible. We are responsible. South Africa is taking responsibility." Along with HIV, South Africa also has high rates of diabetes, high blood pressure, and tuberculosis. Health Minister Aaron Motsoaledi says the campaign will be used to improve all health care. People who get tested for HIV will also get other services, including screening for blood pressure, blood sugar, and TB. In June, the eyes of the football world will be on South Africa when it becomes the first African country to host the World Cup. And that's the VOA Special English Health Report. For more health news, go to voaspecialenglish.com.
This is the VOA Special English Health Report. Malaria is caused by a parasite spread by infected mosquitoes. The World Health Organization, in its latest estimate, says the disease caused 781,000 deaths in 2009. Most of those deaths were in children in Africa. Worldwide, there were 225 million cases of malaria. Both of these numbers represent improvements. In 2000, there were an estimated 233 million cases of malaria and almost 1 million deaths. Malaria remains a major problem in Africa. But there have been some successes. Deaths in Rwanda, for example, have been reduced by 60%. There are still no vaccines to prevent malaria. The main way for communities to control the disease is by controlling mosquitoes. In a recent study, researchers in West Africa have shown that spraying insecticide indoors can greatly reduce malaria transmission. The fight against malaria has two main targets: the parasite itself and the mosquito that carries the parasite. Insecticides target the mosquito, but over time, the insects develop resistance to the chemicals. This has been happening with current mosquito killers, including chemicals known as pyrethroids. Gilles-Germain Padeneau and other researchers in Benin tested another insecticide. This one is called bendiocarb. They tested it with indoor spraying at sites throughout Benin. There were fewer mosquito bites in homes sprayed with bendiocarb. More importantly, none of the 350,000 people who lived there got malaria-infected mosquito bites during the test. Piper Hotez heads the American Society of Tropical Medicine and Hygiene, which published the research. He says, "This is what this bendiocarb is all about, showing that it's efficacious, at least in this setting in Benin, in a real live field setting. So it provides a potentially good alternative where there's been high development of resistance to pyrethroids." Dr. Hotez says the effectiveness in the test does not mean all malaria programs should use bendiocarb or that indoor spraying should be the only method used. We're going to have to throw multiple things out there in order to see what the optimal combination is to achieve control. Bendiocarb is widely used against a number of different insects. The insecticide is considered relatively safe when used as directed. For VOA Special English, I'm Carolyn Prisuti.
This is the VOA Special English Health Report. Programs that teach young people how to avoid abusive relationships are generally for high school or college age. But new programs are being created for younger students because they too experience abusive dating relationships. Earlier this year, the Robert Wood Johnson Foundation released a study done in the United States. 15% of 7th graders in the study said they had been the victims of physical violence in a relationship with the opposite sex. 7th graders are about 12 years old. Kelly Miller, a lawyer in the state of Idaho, directs a program called Strong Start Idaho. It started 3.5 years ago. The goal is to help 11 to 14-year-olds learn the skills to have healthy and safe relationships. For example, she teaches them to wait a second and breathe before they make a decision. Ms. Miller says a big problem for young people is that television programs, video games, and movies often show violent relationships. Mobile phones and the internet can also create problems. Kelly Miller says young people need adults to teach them what it means to have a healthy relationship Several American cities have received money from the CDC, the Federal Centers for Disease Control and Prevention, for programs to prevent abusive relationships. A private organization called Men Can Stop Rape has groups for boys between the age of 12 and 14. These Men of Strength groups teach boys that being a strong man is not always about physical strength. They learn that if they respect themselves and others, they will be men of strength. They are also taught that they can be allies of girls and women. A CDC study showed that boys in these groups are more likely to help a young woman who is being mistreated by another boy. In Idaho, the state does a youth risk behavior survey each year. Ms. Miller says the number of high school students who say they have been physically hurt by a dating partner has dropped by 6 percentage points in the past 6 years. Next week, we look at some of the skills needed to build healthy relationships. And that's the VOA Special English Health Report, available online at voaspecialenglish.com. Read, listen, and learn English with our programs and activities. You can also find links to the Start Strong Idaho and Men Can Stop Rape websites. I'm Mario Ritter.
This is the VOA Special English Health Report. A new study of the brain is helping scientists better understand how humans process language. The study is being done in the American cities of San Diego, California, Boston, Massachusetts, and New York. One of the patients is a woman with epilepsy. Doctors are monitoring Denise Harris to see if she is a good candidate for an operation that could stop her seizures. They are monitoring her through wire electrodes implanted in her brain. But while she is in the hospital, she is also helping scientists understand how the brain works with language. The study centers on a part of the frontal lobe called Broca's area. Pierre-Paul Broca was a 19th century French doctor. He first recognized the big part that this small area plays in language. The electrode implants have shown that the area very quickly processes 3 different language functions. Eric Halgren at the University of California, San Diego School of Medicine is one of the main investigators. He says they found different regions doing at different times different processes, all within a centimeter. The first function deals with recognizing a word. The second deals with understanding the word's meaning within a sentence. And the third lets us speak the word. Harvard University brain expert Steven Pinker is another author of the study. A report on the work appeared in the journal Science. Ned Sahin, a researcher at Harvard and the University of California, San Diego School of Medicine, was the first author of the paper. He says scientists have known for some time that traditional explanations for how parts of the brain work need to be changed. One such belief is that there is a separation of language tasks between 2 very different parts of the brain. One is Broca's area at the front. The other is Wernicke's area further back in the brain. That area is named after the 19th century German neurologist Karl Wernicke. The belief is that Broca's area is responsible for speaking, and that Wernicke's area is responsible for comprehending. But the new study shows that Broca's area is involved in both speaking and comprehension. Neil Sahin says this shows how parts of the brain perform more than one task. Yet, even with new findings like these, much about the brain still remains a mystery, at least for now. And that's the VOA Special English Health Report. This is the VOA Special English Health Report. A new study says fewer women in developing nations are dying of pregnancy-related causes. Researchers estimated how many mothers died during or soon after childbirth in 181 countries. They found a drop of more than 35% worldwide in the past 30 years. By their count, the number fell from more than 500,000 in 1980 to about 343,000 in 2008. That year, about 250 mothers died for every 100,000 live births. The researchers say the maternal death rate has been falling almost 1.5% a year since 1990. Earlier reports suggested little change between 1980 and 1990, but the new study disputes that. The researchers used government records, medical records, surveys, and other information. They say the progress is a result of greater efforts to reduce maternal deaths. Christopher Murray at the University of Washington's Institute for Health Metrics and Evaluation in Seattle led the study. He says more education of women in developing countries has helped lower maternal death rates. More of them are giving birth in hospitals. Dr. Murray says lower fertility rates around the world, combined with higher earnings, are also reducing deaths. The nations found to have the biggest reductions were Egypt, Ecuador, and Bolivia. The researchers say China also had a sharp drop. But since 1990, maternal death rates have risen in some countries. Zimbabwe, for example, had a 5.5% increase per year. Afghanistan, India, Pakistan, Nigeria, the Democratic Republic of Congo, and Ethiopia also had increases. HIV has slowed the progress in reducing maternal deaths. The study linked almost 1 in every 5 such deaths in 2008 to the virus that causes AIDS. The researchers say maternal death rates have also increased in some wealthy countries. They found the number in the United States rose almost 42% since 1990. Countries such as Canada and Norway also had increases. Dr. Murray says at least part of the increase is likely the result of better record keeping. The study in The Lancet also included the University of Queensland in Australia. And that's the VOA Special English Health Report.